In just 6 years, the number of deaths a year from opioid overdoses in the U.S. has doubled to more than 42,000. The opioid crisis is so bad the Surgeon General encouraged more Americans today to carry an overdose antidote. And Jericka Duncan in Philadelphia tells us America's sixth largest city is now considering opening supervised injection sites.
My chest was so bruised and, hurt from people giving me CPR constantly. It was ridiculous. The heroin is out of control, completely. Any corner you go to, you can get the heroin. People, are overdosing left and right, like it's no big deal.
For the last 13 years, this 30-year-old woman who goes by Rachel has been getting high.
Come under the sheet. I'm actually trying to get into a detox, so I don't want my habit too out of control.
She's a mother of two, but her desire to care for her kids, she says, isn't strong enough to pull her from under a sheet of darkness and away from her body's calling for heroin. Last year, more than 1,200 people died of a drug overdose in Philadelphia, a number that's tripled in the past 5 years. To address that problem, Philadelphia is moving to become one of the first cities in the nation to allow so-called safe injection sites, where people can go and shoot up heroin under the supervision of healthcare workers. It's part of a new approach to tackle the opioid crisis by treating it as a public health issue. The site could end up here in Kensington, where it's not uncommon to see drug users walking around, some of them living here in these tents. Now, just last night at a public hearing about a block from here, people who oppose injection sites in their neighborhood explained why.
When you say this is best for saving lives, you're not including our lives. You're not thinking about me and what I experienced growing up. You're not thinking about my children who will be exposed to this as long as we live.
We have a crisis here in Philadelphia.
Philadelphia Health Commissioner Dr. Tom Farley.
If I'm a heroin user and I walk into one of these facilities, what can I expect?
These facilities look sort of like a clinic. If they're simply there to inject, they bring in their own drugs that they have bought on the street. They're given sterile equipment, and they inject at that site. If they were to have an overdose on site, there are medical staff on site who can revive them.
Philadelphia is taking its cue from Vancouver, Canada, which opened its first legal injection site nearly 15 years ago. Right now, there are approximately 100 supervised injection sites in 66 cities around the world. The Drug Enforcement Administration sent CBS News this statement that says, in part, safe injection sites violate federal law and are therefore subject to legal action.
But if you're not able to do that legally, isn't that a problem?
Syringe exchange programs operate in a legal gray zone and have done so for years.
In the U.S., Seattle and San Francisco are considering similar measures and could open sites sooner. Back in Philadelphia, people like Mark Easter say the benefit is life.
And we want a safe place to inject it. We want a safe place to know that we can test the drug that we're injecting into our bodies to know whether or not if it's actual product.
And Jericka's in Philadelphia now. Jericka, obviously a very controversial idea. Where would the funding come from?
Well, a spokesperson for the mayor's office says tax dollars will not be used. City leaders are basically hoping that a private company will step up to actually run this. But, Jeff, the facilities could be here in Philadelphia as early as next year.
And they're also hoping that officers don't pay attention because it's illegal. We should mention, as you did as well. Jericka, thanks very much.